You all know the parts of fixed partial denture. Parts of a fixed part. First, what is fixed prosthesis? Fixed prosthesis means any dental prosthesis that is luted, screwed, or mechanically attached or otherwise securely retained to natural teeth, tooth roots, and or dental implant abutments that furnish the primary support for the dental prosthesis. This is the definition of fixed dental prosthesis. Coming to components of fixed posture denture, connector which connects pontic and retainer. Retainer is which retainer is a complete crown which will be on the abutment, prepared abutment tooth, and prepared abutment tooth. Abutment tooth is not a part of fixed partial denture. Fixed parts of fixed partial denture means only retainer, pontic, and connector. These three are the fixed partial denture components. Pontic means it's an artificial tooth which replaces the natural missing tooth. So this is the components of, these are the components of fixed partial denture. For an accurate and successful placement of these components, an abutment tooth requires preparation to receive or establish the foundation and to determine the performance of restoration. We cannot directly put a retainer on the unprepared abutment tooth. We have to prepare the tooth, reduce the natural tooth structure, and over that abutment tooth, we have to give a retainer. Coming to what is tooth preparation? Tooth preparation is defined as the mechanical treatment of dental disease or injury to hard tissues that restores a tooth or original form. This is according to Tillman. According to Glossary of Prosthodontic Terms 8, the process of removal of diseased and or a healthy enamel and dentin and cementum to shape a tooth to receive a restoration. This is the definition of tooth preparation according to Glossary of Prosthodontic Terms 8. And reduction of tooth structure is preceded by a mental image of the design of the artificial crown and the anticipated occlusion. What are the objectives of tooth preparation? Support retainer and provide resistance, preservation of health of tissues, durability, and aesthetic. These are the objectives of a tooth preparation. According to Dr. Lloyd Miller, no other clinical procedure in fixed prosthodontics reveals the care, skill, and judgment used by a dentist than the quality of tooth preparation. Coming to other stepping stones for success of fixed partial denture. First, proper diagnosis and case selection. Case selection and should be proper. By selecting a case, see the pulp chamber, angulation, and interarch distance. Everything should be considered. After that, tooth preparation. Tooth preparation, we should follow all the principles and prepare the tooth. Next, soft tissue management by giving supragingival finish lines and while taking impressions, using this gingival retraction card. These are all soft tissue management. And impression making. After tooth preparation, impression should be proper. If proper impression is not recorded, you will get a fault cast and impression. Next, further the process also will fault. Next, provisionalization. After tooth preparation and before the cementation of the final restoration, the prepared tooth should not left like that. It should be covered with some provisional restoration, which covers the prepared tooth and it functions as artificial tooth, original artificial tooth. It should maintain the occlusal contact with the opposing arch, and she should not allow the drifting of the adjacent tooth into the prepared tooth surface, space. And last is case delivery. While this cementing the case, cementing the